Good afternoon, everyone. I'm Dr. Samiksha. I'm working as a digital professor at the Indian Institute of Public Health, Hyderabad. And I'm here to talk about outbreaks, epidemics, and pandemics, especially in this scenario of COVID-19, where it becomes highly essential to understand these concepts and apply them for any outbreaks in public setting, and more so, the precautions that you should be taking for yourself in the hospital settings, and then how to apply these principles for identification of any outbreaks and management of any outbreaks in hospital acquired infections. The principles usually remain the same. So here we start the presentation. As you are aware that this is in a module form, so after this session, we would like that you understand and be able to implement concepts of outbreak investigations to hospital outbreaks. We will to learn from an ongoing example of COVID-19 pandemic, control measures, and how they are similar to any infection prevention and control strategy implemented stringently. You should be able to realize the necessity and current opportunity for initiating and establishing infection prevention and control activities in your hospitals. These not only reduce the burden of COVID-19, but they are similar to reducing any hospital acquired infections and many other hazards that may happen. So, as per the definitions, outbreak is any increase in the occurrence of the number of cases of a disease above what is normally expected in a population. So, one thing important here is that you should know what is normally expected of the disease infection in hospitals. You may see a lot of infections already coming in, but if there is more, more than expected, then it is called an outbreak. It isn't sudden in onset. It can start with a single case when you do not expect any case at all. So even a single case can be counted as outbreak. Whereas in some places where you have few cases already coming in that case, a sudden increase may be called as outbreak. The outbreaks may not only be infectious in nature, they can also be chemical, which can cause outbreaks. There are continuous leaks of chemicals in the hospital setting or in the public setting, which can lead to sudden increase in side effects caused due to those chemicals. Epidemics are outbreaks, again sudden in onset, but they usually, uh, spread out in a population or a defined region. It always starts as an outbreak, and then when it spreads to a confined region, it is called epidemic. When it further spreads to a larger geographic area and covers a lot of countries and different communities, then it is called pandemic. For example, when it started in China, it was called an outbreak, it was called epidemic, and then when COVID spread to many other countries, then it was labeled as pandemic. Pandemics is not new. They have happened in the past, and there's a whole history of pandemics of different diseases, mainly infectious diseases in the past. I'm just naming a few major ones which have happened in last century. So Spanish flu, you tend to hear about Spanish flu a lot. So Spanish flu was amongst the very big ones which affected the whole world in 1918 and 1919, and it resulted into estimated 40 to 50 million deaths. Then in mid 1900s there was Asian flu which claimed 1.1 million deaths. Then in 68 to 70 there was Hong Kong flu which claimed 1 million deaths. And HIV/AIDS. HIV/AIDS is also called a pandemic because this virus we did not expect earlier, and when it presented from 81 onwards, it has been on a continuous rise, and it still continues. Although the rate at which it's spreading has decreased, but it is still called pandemic because it has affected the whole of the world, and it continues to kill people. And till date, we can say that around 25 to 35 million deaths have been claimed by HIV/AIDS. Latest big and pandemic, there have been a few more in between, but the latest big pandemic, which is of concern right now, is ongoing COVID-19, and so far it has already claimed 4.3 million deaths till 31st July 2021. And as you can see in the map, it has affected all over the world. The places in dark blue are affected worse, and those in light blue are affected less. This, the map which has come out is basically of swine flu, which was in 2009 2010. I said there have been few before COVID also. Even swine flu has affected a lot of people and a lot of countries, and it also claimed around 200,000 deaths. So in the recent, when we have started to do a lot of control measures, when we have medicines in place, when we have regulations in place, even then swine flu could claim 200,000 deaths. And if you see compared to that, COVID-19 in today's time is a very big disaster. Apart from pandemics, epidemics is a usual phenomena. They are usually confined into smaller regions. We may not get to know about many because it may not touch the news, our local news as much, but it's just a map here to show that they keep reporting, they are common, they repeatedly occur, and from different parts of the world where there are good surveillance systems and there are good reporting mechanisms, you tend to pick up outbreaks and epidemics early and you tend to take control measures early. But this map is just to show there are all kinds of infections which occur as epidemics, which are sudden in onset, not expected in those regions. They come, they affect the population, and then they are controlled. So, what are the major causes of any outbreak or epidemic? Usually, they are infectious in nature. They may spread from human to human, they may spread from animal to human, they may spread from any vector to human, or it will be environmental disease which spreads and hospital acquired infections. Epidemics can also be animal to animal. In all other examples, we have given humans because we tend to be more concerned about humans. However, animal to animal outbreaks and epidemics are also very common. And now, when the interaction between animal and humans has been increased, there's not less of boundary between the two. These epidemics should also be monitored. Otherwise, these epidemics and the mutations which happen so fast, these epidemics can easily cross the borders and reach to humans and also become new epidemics in humans of unknown bacteria or viruses which have not affected humans earlier. So it is important to keep track of any kind of infections all across the world. So why outbreaks may happen? We know infections are already there everywhere. So usually outbreaks may happen that there is an existing agent, but there is sudden increase in the virulence of the agent. Like coronavirus has already always been there in the communities and root cause mild infections, similar kind of pneumonia kind infections. But this newer strain, which is highly virulent, it has caused sudden increase in the outbreak, right? Uh, or it is possible that there is new agent which increases the transmissibility and the transfer of the uh, disease, virus, or bacteria from one patient to another. If there is something like that, it can cause outbreak. It can happen that the mode of transmission is increased, or let's say immunity of the people have decreased over a period of time, or the people with poorer immunity they stay together. Like if you see the example from Europe, the first COVID pandemics, when they spread, they highly affected the old age homes or where colonies where elderly used to live. It was because the susceptible people were all together, and this gave chance of the virus to spread faster. So another example is that if you are keeping the disease under control due to vaccination, and over a period of time, if the immunity of the population decreases or the vaccination is not done anymore, so over a period of time, the population, the new generation which is born, is usually susceptible to the new infection. So the bacteria and virus may be there in the environment, but the population was not susceptible earlier. And then population, when it becomes susceptible, it can cause a higher mode of transmission and can lead to outbreaks. Then susceptibility of the host can change, like uh, autoimmune diseases or some other diseases, which can increase the chances of person getting secondary infections. And just due to some other factors, the exposure is more. For example, globalization, we move around a lot. In earlier times, we may not move as much around. So now, because people move around much, they interact with people, the lifestyle has changed. It's possible that certain kind of mobility, certain kind of lifestyle, certain kind of interaction just increases your chances of exposure to the agent, which can cause the disease. And they can be newer portals of entry also. You may think it is just oral in nature, but something changes in the host or something changes in the virus and bacteria, then it can be transmitted through aerosols, droplets, touch, multiple things. So a lot of things can change in the existing host or the agent, which can lead to increase in the or formation of outbreaks. So there's a that pattern of epidemics and the phases it goes through. Like the first phase is where you anticipate there could be any outbreak. These outbreaks, pneumonia like outbreaks, are always anticipated. We have influenza like outbreaks several times in the past, and we were the world always anticipated that with the current lifestyle, any kind of aerosol based, droplet based, touch based infections can quickly spread. And with a lot of mutations that happen, uh, it was always in anticipation that H influenza or coronavirus or similar virus can lead to outbreaks. However, we are never sure when those kind of mutations may happen. So we then the next phase comes is that we are always on a lookout and we detect these infections early as soon as they start to come. Early detection of outbreak and early detection of epidemic becomes very important because it is localized at that moment of time. If you can contain it completely, it will not spread. But if you fail to contain the epidemic, then it increases, it amplifies. Then only thing you can do is try and control and mitigate the side effects or the harmful effects on the society. And then the infection is sustained for a longer period of time. Over a period of time, the susceptible population may have died or they have developed immunity. And then when the transmission reduces to very less, then you can think of elimination or eradication. That is a simple pictorial presentation of how any new infection or any new outbreak would be spreading in the community. So it is highly important that we always stay on lookout of new infections or outbreaks. We investigate them and we try to contain them before they spread. Once they spread, only thing we can do is management. Like now in COVID-19, we are not in a stage to contain it. The earliest steps which were taken to do lockdowns, block the whole area where any infection would come, contain it, or lockdown of the societies, those steps could have worked only in the early stages. Now, when there is community spread, the best you can do is you can just do epidemic management and control as far as you can and mitigate the side effects or the harmful effects or uh, the economic, social, health, mental. There are a lot of effects that happen due to a widespread pandemic. So that's what we are trying to do currently. So in outbreak investigation, as I'm mentioning about it, and this is what the important lecture is about. How do we detect outbreaks and how do we investigate outbreaks so that we can take immediate actions and contain it. I repeat, the principles of what we are talking for public health outbreak investigations are similar and they should be applied to hospital based outbreaks as well. The way outbreaks can be investigated or detected early is that there should be an ongoing surveillance system. We have IDSP in place, and in the government of India, we have strong mechanism by which any new cases or sudden increase in cases should be reported to district administration, and through district administration, it should be reported to central government. And then central government identifies if it is an outbreak or epidemic, and then they go into investigation. Similar thing should happen in hospitals. Every hospital, big or small, should be able to do a surveillance and keep a record of what are the common infections that are coming in OPD, what are the common hospital acquired infections that are happening, and keep a track of them. Any increase in the nature of patients coming in OPD, or the kind of lab samples coming in the labs, or the kind of bacteria or viruses that are being detected, or the resistant bacteria or viruses that are detected in hospitals, they should be a alarm that okay, we are finding something new, unexpected, out of proportion, and then we need to look into it, investigate, and control it. So, what do we basically do? Once we detect a threat that there is an increase in certain kind of cases, then you try to define them. You try to uh, make a list of all those cases, and along with what time they developed the infection, where all did they go, what kind of exposure they would have. So you do a whole filling up of form. You do line listing, you do filling up of the form, and then you try to analyze your data. So the analysis is done in three broad categories. Basically, you try to see what was the time distribution of cases. It will tell you what kind of epidemic it was, at what places it was spread. Was it in urban or rural or tribal, near hospital or resettlement colony, or which kind of colonies it is spreading. Place tells about that. In hospital setting, is it in ICUs, or is it in wards, is it in ICUs with ventilators, or is it in step down units? Where is the infections starting? So the place becomes very important. And the third thing is person. What kind of people are getting infected? Because then you target your interventions only for those people. So these are the three things which we want to analyze for. Let's have a poll. And the first question here is, what kind of pandemic is COVID-19? Is it point source, or is it continuous common source, or it is propagated, or mixed? You have 20 seconds to reply that. You have the poll already on your screens. Just select the option, and whatever option you will choose will reflect in our poll, and we will be able to give you the answers. So, yeah, what kind of pandemic is COVID-19? Is it point source? Is it continuous common source? Is it a propagated pandemic or mixed? Hope you have marked your answers. Okay, going to the next one. The next question is, the recent pandemics that we had in last few years or last few decades, what was the common route of transmission? Was it contact transmission? Was it aerosol or droplet transmission? Was it vector based transmission? Or was it foodborne transmission? Just think of the transmissions of the pandemics which I just spoke about, and think about it. What was the route of transmission in the latest pandemics? This is important to know because we know how our populations are susceptible and what kind of source, and how we should take measures in long term to control such pandemics to happen. Yeah, another 5-10 seconds before you record your answers. Okay, so the correct answer for the first one is
We are ending the poll in 5 seconds.
propagated. You see there are third waves every time the wave is bigger than the previous. And the answer for the second one is aerosol or droplet transmission. SARS, swine flu, coronavirus, The common thing they had was that they had aerosol and droplet transmission. Okay, Srinath, can you please give us the poll results? What percentage replied the right answer and what percentage couldn't? So just a
Yeah.
little bit on what the time tells you and how do you analyze it. Okay, see, I briefly told you the steps of outbreaks, and these steps of outbreaks can be read and are available as a source everywhere. We can also provide you with that source, but just in the shortage of time, I'm trying to focus on how to interpret your data. So, as I said, you do a continuous surveillance. Whenever you see a increase in cases, then you line list them, you record certain information which is relevant, and then you analyze your information. So if you try and make a chart like this, or each day you chart the number of cases, you plot a histogram, and then see how the outbreak is behaving, it will tell you a lot of things. The first graph, as it shows, it has common onset, uh, common source outbreak. So there would have been one source of infection, and you will see there will be a sudden increase in cases and sudden decrease in cases. And this usually happens within one incubation period. In such kind of outbreak, you don't have to do much. You have to ensure that that point source is not active anymore. These are self limiting, and these outbreaks will close by themselves. However, if you see a graph like this one, which is growing, and it goes there to peaks, they continue to happen, and it is longer than the incubation period, such is a continuous exposure. So the exposure, the infection source is there and it continues to happen, continues to infect more people. So once you detect it and you identify the reason for it, for example, you can say identify that it is the water main line broke, because of which there was infection, the water got contaminated, and by the time they realized, okay, this is due to water contamination, they started boiling the water before use and the chlorination. The moment they started doing any control measures, the epidemic came down. Before that, before any control measures were brought in, the epidemic was on a continuous rise because of that common source which continued to infect other people. Then there's other kind of spread of infection like propagated, which is our COVID-19, where the infection happens, and this can happen in many infections in ICUs and your wards. Few people infected cases come into your ward, they infect another few, and there is one peak which is within one incubation period. Then these people infect many other people who they get in touch with, and within another incubation period, you will see another peak, and these people then further go out and infect other people, and there is another. So these kind of peaks keep coming, and the first peak is smaller relatively, second peak is bigger than the first, third peak is bigger than the second, and that usually happens because one will infect two, two will infect four, four will infect eight, eight will infect 16. That is how it propagates. And that is exactly what is happening in COVID 19. So if you see this kind of a distribution of your cases with time, you know it is propagated and it is spreading from human to human and faster. And then you have to take control measures accordingly. Lastly, it can be mixed type. Would have started as common exposure and would have led to a propagated type. Now, as I said, place is important. So, the first example comes from a spot map which was used for cholera outbreak in London, used by John Snow, and he used spot maps to see where the cases have come, and then he saw that the cases are concentrated of cholera concentrated around one street, around one hand pump. And with that, he made a hypothesis that this hand pump might be the source of infection. He got this hand pump removed, and the moment he got this hand pump removed, the cholera cases drastically came down. So the place distribution can help you identify where is the source. So if you make such kind of maps for your wards or your ICUs and have a spatial understanding of how the cases have spread, then also you can identify what could be the point source for infection. Lastly, as I said, person is highly important because you have to understand, is it affecting a certain age group, certain gender, immunized versus non-immunized? Are there any comorbidities which are contributing to higher infection rate and as well as mortality rates? Any particular occupation or migration or genetic makeup? This is again important. For example, you saw in COVID-19 that we initially, when studied, we realized that the infection is more in elderly and those with comorbidities. Even death rates were more amongst the elderly and those who had comorbidities. And the younger children were spared of the infection. So your whole intervention was then more focused and towards the elderly and those with comorbidities, what precautions they should take, and who should get hospitalized. So those kind of things. So understanding of the person characteristics also helps in developing your control measures. And these person characteristics can further be, defined in terms of infection rates, disease rates, and death rates. Which age group is getting more infections and disease and death? Which gender is getting more of these, or are how the immunized? So that kind of stratified analysis can help you in again deciding how and what to focus on. Then, in the outbreak investigation, apart from the people who are getting disease, it is important also to study the agent which is causing the disease. Is it new? Is it reemerging? Is there any mutation in it? You have to understand what is the exact uh, virus or bacteria like. Then how is it transmitting? You have to understand the transmission. The moment you understand the transmission, you can look at the control measures. You also look at what is the ease of transmission. If it transmits very easily, then you have to have more stringent control measures. Okay. Then transmission, is it transmitted by asymptomatic people also or only symptomatics? Are there carrier stages or the treated people can also spread the disease? This again understanding is important. Like in COVID-19, even the asymptomatic COVID-19s can spread the disease. Symptomatics definitely. However, it is less known that the treated COVID-19 patients can continue to spread the disease. Right. So then you have to be careful. What message to give to the community? Then how virulent is the agent? How quickly it causes the disease? And what are the host factors which contribute to this virulence? What are the prevention measures available for this virus? Is there any vaccination already there? If there is no vaccine, do we need to develop vaccine? Does it require hygiene and sanitation? Does it require any kind of specific protection? So, the type of agent will help you understand what specific clinical or sanitary measures to be taken. And the incubation periods, because you have to understand within how many days you are likely to develop disease. So, for how long you have to monitor or observe your contact peer persons or contact patients. And also look into what are the disease and complications that may happen because of this agent, and what are the treatments available for these. So just quickly, the example of COVID-19 that we look into, that globally, if I define in terms of persons, it tells me how many people have been infected, what is the number of people who have died, and total rate in terms of number of cases per million population, number of deaths per million population, uh, number of vaccinated, and again the rate number of vaccinated per million population. So if you see, thankfully, the number of deaths per million population in India has been lower than what is reported globally. And this could be due to several reasons, maybe because of younger population that we have, or maybe because of underreporting. But yeah, this is what the reported numbers say. And the vaccinated are definitely lesser than the global average, and we need to increase it. This is just an example to show in terms of time. So different colors show different regions, but overall it shows about the world, and you can clearly see There's one wave, then there's second wave, and there's a third wave forming. This is a clear example of propagated uh, epidemic, or we call it pandemic for COVID-19. Typically, as I was mentioning earlier, and this is the map showing how it is spread. So WHO makes weekly maps. So weekly, you can see which area is showing more concentration of cases, and then you can have all kind of travel restrictions accordingly. It is not a static map. In pandemics, you keep seeing the trend of movement in form of maps, and where it is increasing, where it is decreasing, what control measures to take. Within India as well, if you see if it is increasing in Maharashtra or Kerala, you will see a lot of travel restrictions or advisories for those states. If it is not as much in Delhi, so you will not have in Delhi as much. But people coming from Maharashtra and Kerala, they should be looked checked. If it is similar in all the states, then the advisory may change. So a lot of travel advisory you must have seen has changed over a period of time, because we are keeping a track of how the cases are rising and in what regions. Yeah, this is to show the deaths per 100,000 population. In India, this is as on June 21. I couldn't get the latest map, but as on June 21, we had maximum number of cases coming from Maharashtra and then southern India. So about COVID-19 pandemic virus, the transmission, we all know that it spreads through droplets, through breath, through cough, and even through contact. uh, it's highly transmissible, and from across the world, the studies that have shown that its reproductive rate, or what that means is that how many people one infected person may further infect, is between 1.5 to 3.5. That means one COVID patient currently can spread infection to average 1.5 to 3.5 people, and this is considered high infectivity compared to many other virus infections of the past. When it is less than one, you will see the pandemic is on decline. When it is more than one, and that duration of time, you see it is at a increase. And there are multiple factors which can affect the transmissibility. Now, about the virus, describing the virus, as we said, there are a lot of variants. You keep reading in the news as well coming up, and the Delta variant is told to be more virulent and affecting the West badly. In India as well, we have already reported cases of even the Delta mutant in Maharashtra. Variant came up in India. So this is the biggest challenge. The more transmissible the virus is, the more infection is spreading and the virus is multiplying. It is subject to mutations, and these mutations may not be, friendly to humans. So we have to do a continuous surveillance and continuous track of the nature of the virus that is causing the pandemic and look at the control measures. Currently, we debate if the vaccine is sufficient for or effective for even the Delta version. So the evidence so far says yes, it is effective, and it reduces the chances of mild. It reduces the chances of severe COVID infection or deaths. So vaccination should continue, and each one of you, especially from the health sector, should get vaccines. You are aware that what containment and control measures have been taken for COVID-19, as by the understanding of what the infection is, what the disease is. The best we could have done is to isolate every case and quarantine in every contact, and for the incubation period we have estimated for this disease, and keep them away. So this was one way of controlling the disease. Second is keep a check actively and passively on the cases that are coming, the kind of virus, what kind of patients it's affecting, right? And lastly, look at some other evidence-based treatments, new antiviral drugs, vaccination, COVID appropriate behavior. These are highly essential at community level, even in the hospital settings, to control and mitigate the impact of the pandemic. The principle of this control is that by doing large community level interventions and hospital level interventions, we can reduce the rate by which the transmission is happening. Unfortunately, we do not have any treatment, absolute treatment for COVID-19. And likewise, for many diseases, infectious diseases, we do not have absolute treatment for those diseases. Some of them are self-limiting also, like in COVID. But the burden they cause in the health system, and suddenly a lot of cases come, even the people who can be saved with some supportive care do not get that supportive care and succumb to death. So in this pandemic, the principle is that everybody should take control measures, even if they're disease or non-disease, they have come in contact or not contact, because we don't know how this is behaving. The best we can do is by using the known protective measures, we reduce the rate by which the pandemic is happening, so that our health systems should be able to manage the number of cases that are coming up. Secondly, if there's a herd immunity concept which works for in case it works for COVID 19, it gives an opportunity slowly for the herd immunity to develop in the population, and hoping that in the longer run, we would be able to either get rid of the virus or be able to live with the virus with immunity in ourselves through vaccination and continuing to do control measures. There's another poll. What kind of people are affected with severe COVID 19? Is it children, adults with no comorbidities, or unvaccinated elderly with comorbidities following COVID appropriate behavior, who are likely to be more affected with disease? Take your time, choose the correct answer. Who are disease? I hope you would have marked your answer. What people are affected with severe disease? Okay. Children, adults with no comorbidities, unvaccinated elderly with comorbidities, or adults following COVID appropriate behavior. Hope you have marked your answer. Okay, going to next. What should a healthcare provider do if he gets a needle prick injury from an HIV positive patient? Should he report to the authorities and take post prophylaxis ARV treatment? Should he take ARV therapy for lifelong? Should he wash hands and do nothing? One prick can't cause infection. Or stop treating HIV positive? What will you do if you get a needle prick injury while you are treating a HIV positive patient, HIV positive mother or a child? Read your options carefully. Hope you have marked your answers. So the correct answer for question 3 is
So we have 15 seconds more. 5 seconds more. We are stopping the poll now.
that unvaccinated elderly with comorbidities are most susceptible to severe disease. And if you get a prick from HIV positive patient, then you should report to the authorities and take appropriate post prophylaxis ARV treatment. Hope you all are aware of it. Thank you. Srinath, can you give the poll results? That was largely an example of public health setting, as I was telling you, and the principles are the same. We have used it for what we are currently in daily thinking. But now I take this opportunity to talk about a case study uh, of an outbreak in neonatal ward that might be more relevant for you in your settings. Not that the earlier thing was not relevant for you because you are all affected by the pandemic, but we also need to be more careful as health workers in our health setting for COVID-19, hospital acquired infections, as well as many other hospital acquired infections, which we are threatened with on in our day to day practice. So, this is an example of a neonatal ward, intensive care unit. So, this had 12 intensive care beds and then 6 high dependency beds and 16 spatial beds. This was a big hall with these many beds in that unit. What they noticed was that on day zero, there was a LBW, low birth weight infant, who was admitted for 7 days and but developed a infection in the eye, and the swab culture showed that it was Pseudomonas aeruginosa, which was an unexpected infection in that unit. So they immediately noticed it, and they tried to look for more such infections for any admission cases in the ward. So what they found is that after 2 weeks of this infection, another neonate, but on the opposite corner of the unit, who was the case of premature necrotizing colitis, also developed Pseudomonas aeruginosa. So when the first case came, they did not consider it as outbreak. They thought it was a chance case. When the second case came, that too in the opposite side of the unit, even at that moment of time, they thought it could be by chance because the case is very far. How could the infection reach there? But they were doing continuous surveillance. That's why they could pick it up after 2 weeks. Then, if immediately after that, within a couple of days, they saw another case, which post-operative case, which developed aeruginosa ventriculitis. And at that moment of time, they felt, no, it is definitely an outbreak. See, just third case, and they declared it an outbreak because it was an unexpected number of cases coming in a shorter period of time of Pseudomonas aeruginosa. Then in next 6 weeks, they continued to do surveillance as well as lot of control measures. Once they have declared the outbreak, they looked into why it is spreading, what kind of patients they were they on ventilator, were they on any uh, or any interventions going there, or the hand hygiene or environmental hygiene was a problem. They looked into a lot of things. At the same time, they continued to measure the cases that were coming. So next 6 weeks, they could record 14 P. aeruginosa infections till the time outbreak ended, and they continued to take appropriate interventions to control the um, outbreak in that unit. So what they did was that they formed first an investigation and a response team. You have to have experts who look into the matter. So they have a microbiologist, they have a public health protection officer, they had epidemiologists who would actually do these kind of surveys and make interpretations. They had infection prevention control representative of the hospital, clinical head and nurse, water safety group, administration, and communication people who would be developing communication material for all stakeholders. They immediately took infection control steps, focusing highly on hand hygiene, and did hand hygiene audits frequently to ensure that everybody was following hand hygiene. If they were not following hand hygiene, then they would reinforce the measures, and it was mandatory to follow all infection prevention control measures in the ward. They did identification of the bacteria, they did typing of the bacteria, they did resistance or sensitivity testing for the bacteria, and used appropriate antibiotics. They, rather than passively waiting for the infections to be noted, that there is active surveillance. And in active surveillance for every admitted case, they look for any kind of bacterial colonization even before they presented with symptoms. It was an active surveillance because even if the bacteria was found in the patient, they would start some prophylactic antibiotics or monitor the patient closely so that they don't develop disease. Unfortunately, they noticed 2 deaths also in this outbreak, accounting to the Pseudomonas infection. In the investigation, they found it was the water system through which the infection would have spread. So they trained the maintenance staff and took immediate actions. and they continued to check for colonization in equipment and appropriately treated all the equipment in the neonatal ward. And they communicated important messages to the patients, the caregivers, the hospital staff, whoever wanted to was required to know it and required to take all infection control measures. Even patients and caregivers have a role. Mainly in neonatal ward, the caregivers have a role in the control of the infection. So this is what they did, and only after that they could control the outbreak in 6 weeks of declaring it as an outbreak. So it's not so simple. You have to act very smart and very quickly. So yeah, this is a small example of outbreak investigation and control in your hospital setting. And then quickly, I'll just take up some examples and what is the problem or burden of hospital-acquired infections due to COVID-19. So, hospital-acquired infections due to COVID-19 are uh, have been more definitely, and in systematic reviews done after this pandemic has become that it ranges from only 5 to 7% of infections acquired in the hospital to as high as 16% of all COVID patients uh, are due to hospital acquired infections. So it's a big range, and the range is obviously affected by how good infection control measures were being followed in the hospital, right? There are multiple factors which contribute to COVID-19 infection spread in the hospital setting, and these are same. If you look at this figure, it is same for any other droplet-borne infection or airborne infection that the patient or the source is either a asymptomatic case or a pre-symptomatic case or super spreader or a disease case through which the virus spreads into the environment through and in the favorable temperature and humidity and poor ventilation, it affects the susceptible population. So it can spread to other patients which are more susceptible to disease. If the doctors and the nurses, if they are not following any precautions and if they are not vaccinated, they are also susceptible. Then they also acquire infection, and that is one way through the droplet. Then it can be through direct contact. Patients can directly spread it to the susceptible population, or it could spread through any contaminated surfaces and then lead to infections. Very simple understanding of how it is spreading. It also emphasizes on where all you need to take the control measures. You have to ensure good ventilation. You have to ensure there is no direct contact, or if it is through any contaminated sources, there is proper sanitization in the wards frequently. And what more you can do is at an individual is take all the COVID appropriate behaviors and get vaccinated. We'll see more of epidemiology factors in the next presentation. Then hospital acquired infections is not just due to COVID, but the COVID patients themselves, because they're admitted in the hospital for a longer period of time, they develop further secondary infections. So in Italy, 47% of sick patients, very sick patients, developed secondary infections. In US, the secondary infections in the overall hospital increased from 1 to 1.6. So COVID brought in increase in the number of cases by COVID itself, as well as the secondary infections that happened. You must have heard about mucormycosis, black fungus. That is also kind of a secondary hospital-acquired infection spreading in the hospitals. That is second way the hospital-acquired infections have increased in COVID pandemic. But there are also good examples. Wherever they realized that the hospital-acquired infection due to COVID is a threat, the hospitals who very stringently followed all infection control practices, not just droplet based, all infection control practices. So there are certain hospitals which also saw a decrease in hospital acquired infections of all kinds, not just COVID-19, of all kinds. So this kind of studies showed that if we, COVID-19 is an important learning aspect. It is an unfortunate lesson for us, but if you learn from COVID-19 and follow all infection control practices. You prevent yourself from COVID-19 and from much more and serious infections that happen in our hospital. COVID-19 is not that serious infection when it comes to history of infections. It's very highly transmissible. But the doctors and the nurses who are at risk of several other infections, if you follow infection control practices properly, you clearly see there's a reduction in hospital acquired infections. And there has been a study which showed that only distancing and hand washing, right? If you do that, the number of cases in hospital-acquired infections increase that way. But if you did wearing mask and hand washing stringently, you will see at the lower end the slope by which, the rate by which infections were increasing was very less. So it clearly shows, in particular in COVID-19, use of mask, hand washing, and obviously equipment sterilization for both the caregivers, doctors, and elderly patients will reduce the way hospital acquired infections spread. So I'm just closing this presentation by telling that what specific steps have been taken to prevent hospital acquired infections due to COVID-19, and you're aware of these in your settings or in the hospitals, that you devise how the patients move in the facility. So there is limited crossing of the infected cases with the non-infected cases, and the transmission is low. You form a separate triage area where the COVID-19 cases are identified and appropriately referred. You designate wards. You had a separate COVID-19 ward where only the COVID-19 suspect or diagnosed cases will stay and be treated. You followed specific high risk treatment procedures and specific precautions. By high risk treatment procedures, we say that if you have to do any intubation, right, any uh, tubation or anything which creates more aerosols, in that you try to avoid those high risk treatment procedures as far as you can, or if you have to do them for the patient's requirement, then you take appropriate measures. Again, even in neonatal wards, in labor rooms at your level, you have to take extra precautions and avoid such procedures. You have to do proper environmental surveillance, regular disinfection of wards, and healthcare practitioners should also be regularly checked for their health status. Use self protection equipment, PPE, hand washing, masks, mandatory vaccination for health personnel. Although we cannot push everyone for vaccination, but if you are uh, aware and cautious about your health and what the latest evidence shows, the healthcare personnel who are definitely at risk of getting and acquiring hospital acquired infections due to COVID-19 should go for vaccination. There should be regular education and training for COVID appropriate behaviors amongst, as I said, healthcare professionals, patients, and relatives. Everyone contributes to hospital acquired infections, and not forgetting the cleaning staff, the housekeeping staff, who also require to be monitored, to be supported very closely, so that infection doesn't spread. Use and segregate your medical waste appropriately, and it should be disposed of appropriately. And lastly, the administration have to ensure, and whoever has administrative responsibilities in the wards and units, that the logistic support is maintained throughout the epidemic control steps. Mm, Learning from COVID-19, we just say that even if you start for infection control practices for control of COVID-19, we say that make it broad spectrum, because COVID-19 is just not one transmission based. There are multiple modes of transmission, and start with forming your infection prevention control committee, or not just a committee for the hospital. At least you can have it for your own unit, your wards. Develop SOPs or use existing SOPs for your units and wards. Use protocols of how to transfer the patient, even if it is for tests. Just follow all those precautions properly so that the infections do not spread from one ward to another ward and one patient to the caregivers or others. Motivate your staff, focus on housekeeping staff, even plan recreation activities for your patients in ICU, for yourself. Because when you are mentally relaxed, the errors are less. And hospital-acquired infections happen more because of stress amongst everyone and the likely mistakes that you do. So, yes, we are all burdened, but find your ways of doing some recreation or stress reduction for your team, your patients, and caregivers. It is very important. Set up a surveillance system. The surveillance, we'll be talking about surveillance system in another presentation today, so I'll keep it for later. Focus on the pre and post prophylaxis for all the known infections. You already know about HIV, pre and post exposure prophylaxis. Similarly, for COVID-19, pre exposure prophylaxis, that is vaccination. So make list of common infections and what pre and post exposure prophylaxis you can follow. Rational use of antibiotic, it is very important. In COVID-19, there is unnecessary use of lot of antibiotics which can lead to resistant bacteria in your environment, can later on give chance of another kind of outbreaks in your hospital setting, so which we have to keep in mind. And please form ways by which logistic support and supplies can be maintained. Now here's
So here is another poll.
last poll for this presentation. What shall you do to prepare for outbreak detection and investigation in your hospital or ward? One is continuous surveillance, or you should form a IPC team which monitors infections and control measures in your ward and hospital. You should have an epidemiologist who should help you in the IPC team in outbreak investigation, or all of the above. Remember, you should be prepared for detection of outbreaks and investigations whenever they appear because uh, they are sudden in onset, right? So you should be prepared for them. So, what would you do to be prepared for the same? Read your options and mark them, please. Okay, last question. What shall you do to control COVID-19 like hospital acquired infections in your hospital? Similar kind of infections in your hospitals. How will you control them? Will you report to the authorities and wait for instructions? Will you take all infection prevention control measures to control droplet and contact based infections? Will you continue with regular services or will you stop OPD services if such kind of outbreak appears? What will you do? Will you report to the authorities and wait for instructions? Will you take all infection prevention control measures to control droplet and contact based infections? Or will you continue with regular services? Or you will stop OPD services when you see any severe cases coming in? Please mark your answers. Hope you will have marked your answers. The correct answer.
10 seconds more. We are now about to end the poll.
Question 5 is all of the above. You will be prepared in every manner. And answer for question 6 is that you will start with all appropriate infection prevention control measures for droplet and contact based infections, even before waiting for the other instructions. Okay, thank you. So, getting it to people, just burden of all.
థ్యాంక్ యూ డాక్టర్ సమీక్ష మ్యామ్. ఇప్పుడు మనము ఈ సమ్మరీని తెలుగులో వినబోతున్నాము. చరిత్ర అంతటా అనేక మహమ్మారులు మరియు అంటువ్యాధులు వచ్చినట్లు మన అందరికీ తెలిసిన విషయమే. ఇటీవల కాలంలో సైన్స్ అండ్ టెక్నాలజీలో జరిగిన డెవలప్మెంట్ వల్ల లేదా వాటి ప్రోగ్రెస్ వల్ల మనము ఈ అంటువ్యాధులను మరియు మహమ్మారులను గుర్తించి వాటి నివారణ కోసము పోరాడగలుగుతున్నాము. రోగాలను ముందుగానే గుర్తిస్తే వాటి వ్యాప్తిని మరియు వాటి ప్రభావాన్ని తగ్గించవచ్చు. ఆసుపత్రిలో కూడా తీవ్రమైన వ్యాప్తి చెందవచ్చు. వారి వ్యాప్తి విచారణ మరియు వాటిని అరికట్టడానికి అన్ని సమయాల్లో సిద్ధంగా ఉండాలి. ఆసుపత్రిలో కూడా తీవ్రమైన వ్యాప్తి చెందవచ్చు. ఆ వ్యాప్తిని అరికట్టడానికి హాస్పిటల్ సిబ్బంది ఎల్లప్పుడూ సిద్ధంగా ఉండాలి. ఎలాంటి వ్యాప్తి సంభవించినా వాటి వెనుక ఉన్న సైన్స్ ఒకటే. వ్యాప్తిని ఎంత తొందరగా అయితే అంత తొందరగా గుర్తించండి, ఒక బృందం ఏర్పాటు చేయండి, విచారణ నిర్వహించండి, అరికట్టడానికి సలహా ఇవ్వండి మరియు కీలక వ్యక్తులను తెలియజేయండి. నిఘా అంటే సర్విలెన్స్. సర్విలెన్స్ మనకు ఏదైనా ఊహించని కొత్త ఇన్ఫెక్షన్ లేదా తెలిసిన ఇన్ఫెక్షన్ లేదా ఔషధ నిరోధకతను కూడా గుర్తించడంలో సహాయపడుతుంది. వ్యాప్తి యొక్క ముందస్తు గుర్తింపు మరియు పర్యవేక్షణలో కూడా నిఘా మనకు సహాయపడుతుంది. ప్రయోగశాల సామర్థ్యాలను కోవిడ్-19 హాస్పిటల్ అక్వైర్డ్ ఇన్ఫెక్షన్ లాగా వ్యాప్తి చెందుతుంది మరియు కోవిడ్ సోకిన వాళ్ళు హాస్పిటల్లో ఇతర ఇన్ఫెక్షన్లు కూడా గురయ్యే ప్రమాదం ఉంటుంది. సాధారణంగా సిఫార్సు చేయబడిన హాస్పిటల్ ఇన్ఫెక్షన్ నివారణ మరియు నియంత్రణ చర్యలు కోవిడ్-19తో సహా అన్ని రకాల ఇన్ఫెక్షన్లను తగ్గించడంలో సహాయపడతాయి. సాధారణంగా తీసుకునే చర్యలతో పాటు కోవిడ్-19 కోసం అదనపు చర్యలు తీసుకోవాలి. అలాగే కోవిడ్-19కి సంబంధించిన టీకాలు హాస్పిటల్ సిబ్బంది అందరికీ తప్పకుండా ఇప్పించాలి. ధన్యవాదాలు. ఓవర్ టు యూ, డాక్టర్ సమీక్ష.
Thank you, Srinath. And we just want to conclude by saying that third wave is just around the corner. And in southern states, it has already started to report, and in the cases have started to increase. And one of the models already predicted by that 15th of July, the cases will start again to increase. If we take stricter precautions, we might be able to keep the peak low, and that's what our intention is. And repeating that if you want to control COVID, the things which are important is vaccination and COVID appropriate behavior in the community, in your hospitals, and keep yourself safe. Thank you.
Thank you, Dr. Samiksha ma'am, for the wonderful presentation.
Can we have any questions? Please, if you have any questions, write the questions in the chat box, or you can raise your hand and ask questions. We note that you people are not asking questions. Is it because the topics are not relevant to you, or is it that we are not understandable? Okay, so Fatima has raised the hand. Can you allow her to speak? And yeah, Fatima, please ask your question. You can unmute yourself and ask your question, Fatima.
Good evening, madam.
Yes. Good evening.
Madam, actually, IPC committee members means who all should be included in that committee, madam, and what all the precautions like you have to take. Like recently, as you have explained, like coming to the COVID-19, we should take particular precautions for preventing the diseases, and we should for the proper surveillance, we should have a committee.
Okay.
So.
Right. Good. So it's a good question. So in the Infection Prevention Control Committee, mostly there are people from the hospital administration itself, except for one or two whom you may require for the overall management. But in these, the role of the hospital heads, the microbiology department representatives, nurses from various wards or senior nurses, then representatives from even a bigger hospital, representatives from units or different departments. They also the housekeeping staff, supervisors. Their representation is also important in the infection prevention committee, right? So there are guidelines how who all should be there and what their roles and responsibilities shall be. You need to understand that in IPC, the role of all doctors, nurses, and housing staff are equally important. So the representation has to be the same. However, if you are a small hospital, that doesn't mean you have to have department representations or you have to have a big committee. As per the caseload and as per the work area you have and the human resource you have, you can identify representatives and form a smaller committee also who can look after all the aspects of infection control, antibiotic use, and housekeeping and other surveillance. Surveillance is done by the one of the parts. It's one of the parts of IPC, and in the committee you identify people who are responsible for analysis of information. However, the collection is usually in. We'll have a presentation on surveillance. So the collection of data has to be decided who will be doing and from where it starts. Starts from the source. Some places the data can be collected in the labs as the lab data, uh, the samples are being collected and the bacteria or virus are being identified. In other kind of surveillance, it can start from the registers in SNCUs. The data is collected from the registers, or they can be different tools where you collect the information. So the responsibility of surveillance then comes on all the staff who are concerned infection control in the hospital. Like you are do in practices to control infection. Similarly, you all become responsible to also record data, and some a designated person can record or extract the information in the given tools. A few designated people look into analysis, right?
Yes, madam. Madam, one more question, madam. Coming to the surveillance, and as you have said that auditing and feedback are essential for the committee. Like, do we have any prescribed checklists, madam, in order to control the infection for this IPC?
Right. So there are several tools, and it is a very big domain. So it depends on you as a unit in charge or a facility in charge. Where do you want to begin with? Do you want to begin with looking at the outcomes in terms of duration of stay in SNC or labor room or type of infections or sepsis patients? Then you will have checklists to extract information about outcomes. If you want to look at the practices like hand hygiene or how the cannulation is done, is it aseptic, then you have different tools to check frequently how the practices are. As I think there's going to be a presentation of surveillance, so your questions on surveillance will be answered then. But thank you, you asked those questions. They are highly relevant, and that's what we want. By end of the day, we should be able to talk about surveillance of at least a few things which are of significance to yours. Okay.
Thank you.
Okay. Next, I see Swarnlata has also raised the hand.
Um, Also, I mean, lot of you will be interested in what precautions should you take for preventing COVID infection, hospital-acquired COVID infection, and we'll be covering those when we come to labor room and the SNCUs and pediatric wards. So we have a special presentation to cover that. But what is important is, as Samiksha said, we have to understand the principle of infection prevention and control, and the same principle apply to COVID-19 also. And we will be using some simple tools to sort of gather that information. We'll be practicing those things, and then we'll be going ahead as we walk over across the 4 weeks. We'll be building on those tools and analyzing those data and understanding what measures we need to take. Okay.
See, it's a 4 week program, so you can come with us slowly, and all these concepts will be trained to you, and some of the tools will also be given to you which are relevant to your setting. So, we just request you all join us every Thursday, 2 to 6. Yeah. Swarnlata has raised hand. Swarnlata, can you please unmute yourself and ask a question? Swarnlata, you need to you want to ask a question. If you want, you can unmute yourself and ask the question.
Uh, there is also a question in the chat box.
Yes, sir.
Srinath, while
Ma'am, there
Swarnlata.
is a question in the chat box. It says that a pregnant woman, after delivery, the people got to know that she was COVID positive. So the person wanted to know what kind of precautions should be taken at these times. I mean, after the delivery, they got to know that the lady was positive for COVID.
Right. So she has to take all the precautions as any other COVID positive patient has to take, uh, isolate from other people as far as possible. Because pregnant woman, although she would require a lot of support in raising the child, but still, as much as precautions can be done by like wearing mask, hygiene, hand hygiene, um, when interacting with other members of the family, she has to do that when and she has to be also monitored for all the COVID symptoms as any other adult. But the important question, I guess, what you're also trying to ask is how to, keep take care of the child while this pregnant woman also has to breastfeed. So in the breastfeeding, it's said that the mother, even if she's COVID positive, she can continue breastfeeding the child. Uh, Only precaution she should take care of is wear a mask while the child is so close to her, and do frequent hand washing or hand rubs when she can, and which she should. Otherwise, apart from that, by contact, if she's maintaining a proper hygiene, breastfeeding, in fact, is highly essential for the newborn. It increases the immunity of newborn, and the baby can stay close to the mother. Other thing is that very small babies, they don't easily acquire COVID infection. So as long as you can manage some barrier between the two, the babies are likely to be safe. You need to monitor them though, and if there are any other family members, they can take care of the baby in between the feeds while the baby is sleeping.
Ma'am,
uh,
sorry to interrupt. The question is also a part of the question is what precautions should the staff take once they get to know that they have delivered a COVID positive woman?
okay, see, in that case, you once you know that it's a COVID-19 positive mother, then as a staff, you have to take all the precautions as any other COVID patient you will take care of. Like, she then needs to be isolated in the ward. She needs to be kept in another room if you have an isolated room, so that the infection doesn't spread to other pregnant women. You have to take all the precautions, infection prevention control precautions for contact, uh, aerosol based and droplet based infections. Basically, whenever you move to the patient's room for any care, you have to wear a mask, do proper hand hygiene after any kind of contact. There is no such kind of prophylaxis that you can do once you get to know that you have come in contact with a positive mother. So for yourself, as a contact, if it is a high risk case and who people who have been involved in delivering such case, ideally they should quarantine themselves as a staff, and they should be under observation for a week to 2 weeks, 2 weeks time, in case to watch if they develop any other symptom. The ward or the labor room where she lived was staying when the delivery was conducted should be properly sanitized. You will have to stop it for a half a day or 2 days, depending on what fumigation you are using. You will have to sterilize all the equipment, all the area before you attend to any other pregnancy in that area. So broadly, these are the steps you will need to take to prevent other uh, mothers to get infection and yourself. Rajan, you want to add?
Yeah, just one more thing. Um, I know many of the health care staff have vaccinated, but there are some who have not vaccinated. And now that the services are resuming, and um, there is lot of emphasis on getting back care to everybody who needs it. That includes pregnant mothers, children. It is high time that those who are not vaccinated also take the vaccines. So I would strongly advocate. now there is a lot of safety data available. All the initial fear and hesitancy should go away. And I request all the healthcare staff, because that would be the biggest protection that you have at the moment. Everything else is secondary and supporting. Yeah. I hope we have answered your question. So
Thank you, sir and ma'am.